Okay, good day, future nurses. Today, we're going to discuss your continuation of your autoimmune disorders. We have here your GBS or your Guillain-Barre Syndrome together with your multiple sclerosis. So, pagdating sa mga autoimmune nervous disorders natin like your GBS and your MS is that they actually have similar problems kung bakit sila nagkakaroon ng ganitong disorders is because of the autoimmune demyelination of our myelin sheath. So let's start first with the discussion of your Guillain-Barre syndrome natin. Okay, so your Guillain-Barre class, okay, the other name for your Guillain-Barre syndrome, we also, okay, call this one as your tinatawag natin na idiopathic polyneuritis. Bakit siya tinawag na idiopathic? It's because most of our neuro disorders, they are considered to have an unknown cause. Okay, wala po silang exact known cause kung bakit sila nagkakaroon ng ganitong mga disorder. And aside from that one, pag sinabi nating polyneuritis, ibig sabihin ng polyneuritis, nagkakaroon po ng inflammation of your neurons. Okay? And aside from that one, pagdating po sa prognosis, ibig sabihin ng prognosis, that is the ability of that person to have this kind of disorder, kung paano po yung magiging recovery niya. So, this GBS is actually this disorder, okay, lahat ng chronic neuro disorders natin, your GBS has one of the best prognosis. Bakit? Because your GBS has a 80 to 90% of them, most of those have GBS or develop GBS, gumagaling po sila. Okay? And aside from that one, your GBS is considered as predictable. Bakit siya nagiging predictable? Because most of the predisposing factors, okay, that causes you to develop your GBS, okay, mabilis lang po siyang i-determine. Like for example, nagkaroon ka ng nagkaroon ka ng respiratory infection. So probably, that will lead to possible GBS. Okay? And of course, pagdating sa involvement ng ating GBS, okay, we actually have two. Ano yung dalawang yon? Dalawang aspect na yun. We have your motor, and we also have your sensory involvement na tinatawag natin. Okay? And of course, pagdating naman po sa ating mga tinatawag na predisposing factors, okay, what are the possible factors, no, that could actually lead or that could, liberate to develop your GBS? Number one, we have here yung tinatawag natin na post-viral exposure. Okay, nagkaroon ka ng post-viral exposure. Ibig sabihin ng post-viral exposure, okay, after you are being exposed, no, to for example, respiratory infections or bacterial infections. Okay, once na na-trigger po yung ating katawan, okay, to develop your tinatawag natin na GBS, okay, that's the time na nagpapakita na po lahat ng mga manifestations natin. Okay, so what are the possible agents, okay, that causes you to develop your GBS natin? Number one, we have yung tinatawag natin na we have your legio debilitans. Okay, we have your legio debilitans. Wherein this causative agent, okay, it is actually associated with your disease na tinatawag natin na polio. Okay, and of course, aside from that one, we also have here your Epstein-Barr. Okay, we have your Epstein-Barr virus. This one naman, it is actually associated with your disorder na tinatawag natin na Hodgkin's lymphoma. And of course, aside from that one, we also have here your Zika virus. Okay, itong Zika virus na to, this is actually added, no, recently, okay, in 2016, okay, doon pa na-discover yung tinatawag natin na Zika virus that occurred in Africa. Okay, and of course, we have here your latest, of course, we have your SARS-CoV na tinatawag natin. SARS-CoV-2 or the causative agent that causes your COVID-19 na tinatawag natin. Okay, pagdating sa kanyang pathophysiologic basis class, sabi natin kanina, ano bang nangyayari sa mga taong merong GBS? Okay, nagkakaroon sila ng polyneuritis or nagkakaroon ng inflammation of their neurons. So, ang kanyang pathophysiologic basis is your polyneuritis. Okay, pagdating sa ating anatomy and your physiologic overview, alam naman natin, no, that your myelin sheath, okay, para saan bang myelin sheath? Your myelin sheath is actually a covering, no, dun sa ating mga neurons or sa ating axons, wherein it helps to transmit faster yung ating mga impulses. Yun po yung ginagawa ng ating myelin sheath. The question is that, pag sinabi kasi natin GBS yan, class, nagkakaroon, sabi natin kanina, nagkakaroon ng demyelination at what tawag dito, division of your nervous system. It's in your peripheral nervous system or in your PNS. Sa kabila naman, for your multiple sclerosis, nagkakaroon ng demyelination of your myelin sheath at your central nervous system natin. Okay, so dito tayo sa ating myelin sheath. Sabi natin yung myelin sheath natin, it helps, okay, to the conduction or transmission of your impulses, okay, faster. Okay, mas mabilis yung transmission po natin ng ating mga impulses from one neuron to another neuron. So, yan po yung ginagawa ng ating myelin sheath. Wherein your myelin sheath, okay, in your peripheral nervous system, it is being produced by what? Meron tayong cell na nagproproduce niyan. Tinatawag po natin siyang Schwann cells. Okay, so your Schwann cells produces your myelin sheath at your peripheral nervous system. Sabi natin your myelin sheath, okay, it transmits, okay, yung mga impulses or yung mga electrical impulses natin or action potentials natin from one neuron to another neuron. Okay, so makikita natin sa illustration natin, this is your myelin sheath that is just a covering, okay? A fiber, tawag dito, ito, example nito is, it is actually a protein, no? A fiber, okay, that covers your, tinatawag natin na mga neurons natin, wherein it helps with the insulation, okay, faster insulation of your neurotransmitter from one neuron to another neuron. Okay, so tong ano natin tong mga myelin sheath natin, ito pa yung mga myelin sheath natin wherein mapapansin natin parang meron siyang clusters, no, or para siyang merong division. Okay, para siyang nakat-cut. Bakit kaya hindi dire-diretso? Okay, hindi dire-diretso yung pagkaka-cover ng ating mga axons. It's because of what? Meron tayong tinatawag na saltatory lip. Okay, we have your saltatory lip na tinatawag natin. Wherein, okay, for example, this is your neuron. Okay, and then nakakover siya with your tinatawag natin na myelin sheath. Wherein, ang mangyayari dyan, para mas mabilis po yung ating transmission ng ating action potential, okay, ganito po siya. Kaya siya tinatawag na saltatory lip. It's because it transmits your, tawag dito, your action potential like this one. Okay, mas mabilis po yung kanyang tawag dito, mas faster po yung transmission ng ating mga electrical impulses. Ngayon, ang nangyayari class kasi sa ating GBS is that nasisira po yung ating mga tinatawag na myelin sheath natin. Kaya nga siya tinawag na demyelination. Okay, pag nasira class, ang ating myelin sheath, what will happen? Of course, ano mangyayari sa ating myelin sheath? Therefore, ano mangyayari sa kanya? Okay, mas slower na yung impulse or yung pag-transmit ng ating mga action potentials or impulses natin from one neuron to another neuron. Okay, so pagdating sa ating assessment class, di ba makikita niyo sa illustration, talagang nasira, no, yung ating mga tinatawag na myelin sheaths natin, and then na-expose, okay, yung ating nerve fiber. Ngayon, pag nag-transmit tayo ng tinatawag na action potential or electrical impulse from one neuron to another neuron, meron pa kayong transmission, of course, slower na ang ating transmission. Okay, so sa ating assessment, let's proceed with our assessment class. Okay, pagdating sa ating assessment, ano usually yung una natin nakikita? We have your paresthesia. We also have your paralysis. Okay, kaya nga siya tinawag na GBS, Guillain-Barre Syndrome. It's because, bakit siya nagkakaroon ng paresthesia? It's because nagkakaroon po ng problem with our, nagkakaroon po ng slower impulses in our what? In our, tawag dito, spinal nerves. Diba yung spinal nerves natin divided dyan into two. We have your sensory and your motor. Therefore, pag slower ang impulse mo, magkakaroon ka talaga ng paresthesia, magkakaroon ka ng numbing sensation. Okay? And aside from that, bakit ka nagkakaroon ng paralysis? It's because since sa ating tinatawag na spinal nerves natin, ano ba yung mga affected dito? Isulat natin. Later on, makikita natin dito. Okay? In your, tawag dito, spinal nerves, you have, di ba, mayroon tayong sensory and your motor. Okay? Pag sa sensory, nagkakaroon ka ng tinatawag na paresthesia. Pag slower ulit ang impulse in your peripheral nervous system, under your what? Under your spinal nerves, we have your motor naman or your efferent. Therefore, magkakaroon ka talaga ng paralysis. Okay? So, ngayon dito tayo sa characteristics ng paresthesia natin and your paralysis natin. Number one characteristic of this one, we have your tinatawag na ascending. Ibig sabihin ng ascending is paakyat po ang pag-occur ng ating paresthesia as well as your paralysis. That's why your GBS, okay, ano yung pwede nating gamitin na mnemonics for this one para hindi nyo siya makalimutan. Pag GBS ascending, tinatawag natin siyang Guillain-Barre Syndrome. Okay, tinatawag natin siyang Guillain-Barre Syndrome. Okay, because of its characteristics na tinatawag natin na paakyat po ang pagkakaroon ng paresthesia, pagkakaroon ng paralysis. Aside from that one class, of course, pag sinabi nating GBS yan, meron kang bilateral na paresthesia and of course your paralysis. Okay, ibig sabihin ng bilateral, both sides of your body. And then last is that we have here your consummated. Therefore, pag sinabi natin consummated, all of the parts of our body are being affected. Okay, so yan po yung characteristics ng ating tinatawag pagdating sa ating assessment or yung mga ma-assess natin for patients who have your tinatawag na GBS. So what is the hallmark sign of your GBS? Mabilis lang pang hallmark sign ng GBS natin. We have your ascending paralysis. Okay, ascending paralysis is the hallmark sign for your Guillain-Barre Syndrome. So sabi natin kanina, no, pagdating sa kanyang prognosis, okay, it is very easy to yung ating GBS. It can be predictable kasi for example, bakit siya nagiging predictable? Kasi nga in the first place, sa una po nagsa-start yung ating problem. Hindi po sa ating CNS. Sa PNS po nag-start yung ating problem. Kaya siya tinatawag na most of our patients who have who are diagnosed with GBS, they have 80% to 90% prognosis and of course because of its predictability. Okay, of course, pag mabilis ma-predict yung disorder natin, mas mabilis siyang i-manage. Okay? So, let's proceed here. Okay, sa ating, for example, sa ating simple pathophysiology, nagkaroon tayo ng demyelination of your peripheral nervous system natin. So, pag nagkaroon ng demyelination, sabi natin kanina, the function of your myelin sheath, tumutulong siya para mag-transmit, okay, a faster transmission of your impulses from one neuron to another neuron. Pag nagkaroon ng demyelination, therefore, it will lead to what? It will lead to slower impulses in your peripheral nervous system. Pag nagkaroon ng slower impulses in your peripheral nervous system, ano ba yung mga affected na aspects natin? Number one, okay, nagkakaroon tayo ng affectation in our cranial nerves. Okay, aside from your cranial nerves, we also have your spinal nerves. And of course, last will be your autonomic nervous system natin. Or your ANS natin. So, mag-start muna tayo with our cranial nerves. Okay? So, usually, ano yung affected na cranial nerves natin pag nagkaroon tayo ng GBS? Number one, we have your cranial nerve number 9. Ano yung cranial nerve number 9 natin? That is your glossopharyngeal. Okay? That is your glossopharyngeal nerve natin. So, ano bang ginagawa ng ating glossopharyngeal nerve? It helps with our what? With our swallowing ability. Okay? Yan po yung ginagawa ng ating glossopharyngeal cranial nerve natin. Ngayon, pag nagkaroon ka ng slower impulse in your cranial nerve, specifically your cranial nerve number 9 or your glossopharyngeal nerve natin, anong mangyayari? Okay, nagkakaroon tayo ng mas mataas na risk or probability ng patient natin magkaroon siya ng Nagkakaroon siya ng difficulty in swallowing or yung tinatawag natin na dysphagia. Pag nagkaroon ng dysphagia yung client natin na merong GBS, what will be the possible complication? Pwede siyang magkaroon ng tinatawag na aspiration. Okay, mas mabilis ma-aspirate yung client natin na merong GBS. It's because of the slower impulse in your cranial nerve number 9, which is your glossopharyngeal natin. Okay, let's proceed now with your with your spinal nerves natin. Di ba yung spinal nerves natin, we actually have two types. It's either a sensory one or a motor one. Okay, so divide natin siya into two. We have your sensory and we also have here your motor. Pag sinabi nating sensory yan, that is your afferent, okay? Away. And pag sinabi naman nating efferent, away from your CNS, okay? Away from your brain, okay? For example, pag sensory yan, away. Pag motor naman or efferent is towards, pabalik. Okay? So ngayon sa sensory natin, sabi natin pag nagkaroon ng demyelination, okay, in our peripheral nervous system, specifically with our spinal nerves, ano nangyayari sa kanila? Pag slower ang impulse, therefore meron ba silang enough nakakayahan ng ating mga neurons na makapag-transmit ng mga sensation in our different parts of our body? Definitely Wala. That's why nagkakaroon sila ng, definitely decrease yan. That's why nagkakaroon sila ng numbing sensation, tinatawag natin na paresthesia. And of course, in our motor aspect naman, pag nagkaroon ng demyelination, is lower ng ating impulses. Therefore, makakagalaw-galaw kayo yung mga muscles natin. Of course, hindi. That's why sila ay nagkakaroon ng ascending, okay, paakyat, ascending flaccid paralysis. Nagkakaroon silang ascending flaccid paralysis that will lead to what? That will lead to possible hyporeflexia. Okay? Decrease ang kanilang reflexes. Nangihina ang mga yan. Okay? Nahihirapan silang gumalaw-galaw. And of course, let's proceed now with your ANS or with the affectation of your autonomic nervous system. Pag nagkaroon kasi class ng affectation with your autonomic nervous system, what will happen? Di ba sabi natin your ANS, okay, meron yung dalawang division. We have your parasympathetic nervous system and your sympathetic nervous system, wherein it also helps with your cardiac system regulation. And of course, aside from your cardiac system regulation, marami pang function yan, di ba, sa ating PNS, ano ba yung mga effector organs natin? We have your bladder, your eyes, and everything. Okay, so ngayon, pag naapektuhan ang ating ANS, because of your, tinatawag natin na autoimmune demyelination of your peripheral nervous system, what will happen to our cardiac system? Okay, number one, what will happen to your heart rate? With our heart rate, pwede ka magkaroon ng cardiac what? Nagkakaroon ka ng cardiac dysrhythmia. Okay, nagkakaroon ng tawag dito, hindi na-regulate ng mabuting ating cardiac system. Kaya possible, si patient pwedeng mag-develop ng cardiac dysrhythmias. Aside from that one, what will happen to their blood pressure? With their blood pressure naman, it's either pwedeng bumagsak yan or pwedeng tumaas. Nagkakaroon ng erratic changes or drastic changes when it comes to their tinatawag na pag naapektuhan po yung ating ANS because of your GBS natin. Okay, it's either pwedeng magkaroon ng hypertension, pwede rin siyang magkaroon ng hypotension natin. Okay, nagkakaroon ng erratic changes, nagiging unstable or yung instability ng ating blood pressure is hindi siya ganun ka-regulated. What will happen also with our peristalsis? Sa ating peristalsis, what will happen? Nagkakaroon sila ng constipation. Bakit constipation? Of course, pag nagkaroon ng slower impulse, okay, what will happen with our peristaltic movement? Of course, babagal yung mga yan. Kaya, possible si client natin na may GBS, magkakaroon yan ng constipation. And of course, aside from that one, what will happen to their bladder? Okay, with their bladder naman, class, is that nagkakaroon sila ng tinatawag na neurogenic bladder. Okay, anong ibig sabihin ng neurogenic bladder? Nawawalan po ng ability yung ating bladder na mag-contract because of a problem in your nervous system. That's why, pag sinabi natin neurogenic bladder yan, nawawalan pa sila ng ability na mag-contract. Okay, so I do hope na iintindihan natin yung discussion natin. Next naman tayo here with your diagnostics natin. Okay, so how will we able to identify, okay, kung meron yung patient natin, meron talaga siyang GBS. Okay, pagdating sa kanyang CTS or your CT scan, also with their MRI as part of our, as part of our, what do you call this one? Imaging diagnostics natin. Anong nakikita din sa kanyang MRI? Anong nakikita sa kanyang CT scan? Meron pa silang, of course, inflammation of their neurons. Kaya kasi tinatawag na polyneuritis. Okay, makikita sa kanilang neurons na talagang inflamed po sila. And aside from that one, pagdating sa kanyang laboratory, okay, pagdating sa kanyang ESR, ano bang ibig sabihin ng ESR natin? That is your erythrocyte sedimentation rate. Ang makikita sa mga patient na meron GBS pagdating sa kanilang ESR is that nagkakaroon po sila ng increase, okay, in their tinatawag na, tinatawag na ESR. Bakit nag-i-increase? Ano bang indication ng increase ng ESR? Okay? Ano ba yung una muna? What is the normal ESR level in our body? It should be what? It should be 0 to 20 millimeter per hour. That is the normal ESR ng isang tao. Ngayon, pag sabi natin, ano bang usually ang indication ng ESR natin? It indicates possible, moderate to, okay, it indicates inflammation yan. Okay, that is the function of your ESR. Sa mga taong merong increase, okay, ESR like in the case of your GBS, meron silang, makikita mo sa kanila, Okay, meron silang moderate to severe inflammation. Kasi nga, ano ba ang problema natin pag GBS? Nagkaroon ng inflammation of our neurons. Nagkaroon sila ng polyneuritis. Okay, so now let's proceed with our management naman po. Okay, so we have here your mnemonics na SBAP. Bakit SBAP po yung management natin? First, we have your letter S. Ang number one na priority natin here is your what? It's your safety. Okay, bakit safety? Sabi natin, nagkakaroon sila ng paresthesia, wala silang namamanhid yung kanilang iba't ibang parts ng katawan nila, nagkakaroon sila ng paralysis. Therefore, kapag ganun, what will be their impending problem? Syempre, there are risks for fractures and injuries. That's why safety will always be our priority pagdating sa ating management for patient who have GBS. So, anong magiging management natin dito is that we have to allow our client to have complete bed rest. Okay, bakit kailangan nilang mag-complete bed rest? Of course, nangihina yung tao. Kailangan nilang ma-regain yung kanilang strength na nawala because of this disorder. Aside from that one, letter B. Okay, we have here your breathing. Bakit breathing? Anong kinalaman ng breathing natin? Since nagkakaroon ng ascending paralysis, pag ngayon, nagkaroon na ng paralysis at the part of your diaphragm, or in your diaphragm helps with your breathing. Pag naparalisado ang ating diaphragm, makakahinga pa ba ng mabuting client natin? No. That's why yung mga may GBS, okay, they have this for what? Problems in their respiration. Kasi nga apektado yung kanilang diaphragm. That's why, ano magiging management natin dyan? Number one, isa kasi talaga sa mga complication of your GBS is that nagkakaroon sila ng breathing difficulties. So, ano magiging management natin for that one? To ease, okay, to help with the breathing ng client natin. Of course, with the use of your mechanical ventilator. Okay, mechanical ventilator. Bakit kailangan nilang mech vents? Because your mech vents, okay, mechanical ventilator is one of the equipment that can actually move your diaphragm. Okay? Next naman tayo for your airway. Bakit airway? Okay? Bakit hindi na unang airway, sir, compared sa breathing? Kasi nga sabi natin ascending. Of course, mauuna muna yung breathing kasi nga maapektuhan yung ating diaphragm bago yung ating airway. Kaya ganito po yung sequential po ng ating management. So next here with your airway, okay? Pagdating naman sa airway natin, class, definitely ano yung mga kailangan natin? We have your iba't ibang equipment natin. Ano yung mga equipment na kailangan natin? Okay, number one equipment, of course, we have your, alam niyo na yan, like, it's been discussed already with your myasthenia gravis, kung ano yung mga needed equipment natin to help with the airway of our client. Of course, we have your suction apparatus, okay, with your oxygenation, of course, with your pulse oximeter natin. Okay, bakit kailangan ng pulse oximeter? To check for the effectivity of the intervention. And of course, pagdating sa ating diet class, same also with your tinatawag natin na MG, since nagkakaroon sila ng problem with your muscles, kailangan din na thickened din po dapat yung diet nila. Bakit thickened yung kanilang diet? It's because they have that risk to develop your aspiration. Kasi nga affected yung cranial nerves natin, nurses, affected po yung ating cranial nerve number 9, which is your glossopharyngeal. And of course, aside from the letter A na isa, aside sa airway natin, of course, we also have your ADL. Okay, with your activities of daily living, what are we going to do? We have to what? We have to assist them with the performance, okay, of their activities of daily living, but we have to teach them also to become independent. Okay? And aside from that one, for your letter P naman, ano naman po yung letter P natin? Of course, when it comes to your pharmacologic management natin. Okay, so ano yung gamot na ginagamit natin for your GBS? Since yung problem natin, class, sa GBS, it is considered as an autoimmune neurological disorder. Therefore, kailangan nating isuppress yung ating tinatawag na nervous system para hindi na po mag-release ng mga antibodies na yan. That is actually destroying your myelin sheaths natin. So, anong gagawin natin dito? Anong ibibigay natin for patient? What will be our drug of choice? We have your steroids. Okay, magbibigay tayo ng steroids kay client natin. And of course, since sabi natin, yung ating GBS, it is predictable, mas okay yung kanyang prognosis compared sa other neurological problems, we can consider this one as what? We can consider this one as meron tayong mga preventive measures para hindi na po mag-reoccur yung mga GBS natin. So, what will be our preventive medication? Okay, treatment natin, we're going to give your IV immunoglobulins para, since yung problem natin dito is that nagkakaroon siya ng, this is considered as autoimmune neurological disorder, we're going to give your intravenous immunoglobulins para masira po yung mga antibodies that causes your demyelination of your myelin sheath at your peripheral nervous system. Okay, so that's it for our discussion with your Guillain-Barre syndrome.